All right, so we're moving to the next. Um, this is kind of like a surgical procedure. So this is what is known as a colpocleisis. Colpocleisis. So for this colpocleisis, it's just a surgical procedure, all right? So it's used to treat what? Pelvic organ prolapse. So if you have an organ prolapse, like your organs are kind of like going down, you know, basically you use this surgery to correct it. All right, use this surgery to correct it, you know. So it's a pelvic organ prolapse, a condition where the pelvic organs like bladder, uterus, rectum, they are descending into or outside the vaginal canal. Now this is because you have a weak, you know, support structures. All right, so what actually happens during this colpocleisis? All right, so basically you know that you have something falling down, so you kind of like want to tighten it up. So vaginal walls are sewn together. Effectively it is closing the vaginal canal. Now this obstructs prolapse because you are tightening it. Do you understand? So it's considered an what? Obliterative what? Procedure. All right, considered an obliterative procedure, meaning it eliminates vaginal function rather than restoring it. Okay, so you're like sewing the whole vagina. You're kind of like denying the woman of, you know, sexual pleasure and all of that, you know. So for the different types, we have the total, where the entire vaginal canal is closed, typically for patients, you know. Then we have the partial, which is what? Colpocleisis, you know. So small drainage tunnels are left suitable for patients who still have a uterus, you know. So what's it for? It's basically for women that have had pelvic organ prolapse, and it's over and over and over again. So typically it also affects older patients who are no longer sexually active, and also those that cannot tolerate reconstructive surgery. So benefits: shorter surgical time, less invasive, high success rates.